Cat CPR technique. CPR is a life-saving technique used to revive a cat with no detectable heartbeat. It is similar to human CPR and works best when started quickly. CPR should only be performed on an unresponsive cat that is not breathing or has no pulse. The first step is to assess the situation. Check if the cat has a pulse or is breathing. If not, start CPR immediately. Next, clear the airway by opening the cat's mouth, pulling its tongue forward, and removing any visible obstruction. The head should be kept straight to ensure a clear airway. Rescue breaths come next. Close the cat's mouth and gently extend its neck. Blow air into the cat's nose until the chest rises. This process should be repeated every 4 to 5 seconds. If there is still no heartbeat, chest compressions are required. Lay the cat on its right side and place your hands over the heart. Use one hand for small cats, 2 fingers for kittens, and both hands for big cats. Compress the chest by 33 to 50% of its width, being gentle but firm. The compression rate should be 100 to 120 times per minute, with full chest recoil after each compression. Rescue breaths and compressions should be combined for effectiveness. Perform 30 chest compressions followed by 2 rescue breaths. This cycle must be continued without long pauses until the cat's heartbeat returns. During CPR, it is important to monitor the cat. Every 2 minutes, pause briefly to check for signs of life. If the cat starts breathing or has a pulse, stop CPR and transport it to the vet immediately for further care. There are key warnings to remember when performing CPR. It should only be done on unresponsive cats with no heartbeat or breathing. Incorrect CPR can cause harm, so if unsure, seek expert help. CPR is only a temporary measure and does not cure the underlying condition. Veterinary care is always needed after CPR. Even after a successful CPR, the cat requires further treatment. Oxygenation and ventilation at a vet clinic help stabilize the cat. Ensuring a safe airway prevents further health complications. Studies show that the success rate of CPR in veterinary medicine varies. The return of spontaneous circulation, ROSC, is 35 to 55% in animals, while it is 61% in humans. Survival to discharge is lower in animals, ranging from 6 to 19%, compared to 25% in humans. Initial CPR success is around 58%, but only 2 to 10% of cats survive after discharge. Signs of successful CPR include normal breathing and a response to touch. High-quality CPR follows proper compression depth and rate. CPR provides several benefits, including saving lives, preventing brain damage, and speeding up recovery in injured cats. It also gives confidence in handling emergencies and enhances safety at home and work. In conclusion, CPR is a vital skill that can save the lives of cats and other animals in emergencies. Knowing how to perform it correctly increases the chances of survival and prevents unnecessary deaths.